Welcome back. It's Ask the Expert. Scott Watson's here from Watson's Pharmacy and Compounding Center, 2 locations here in the Ottawa area. Got a question about hormones, their effects on your body, what you can do about that sort of thing. 613-789-6559, extension 2803. Facebook questions, email questions accepted as well. Scott, I see you have some products that you brought with you.
I do. There are so many different types of natural supplements people use, and you know what? I've seen people use fish oils, evening primrose oil, vitamin B6, and those type of things. For whatever reason, they do help a lot of people. Now, I've also looked into the evidence for all these types of supplements, and there are a few that have a little more promising evidence towards them, and then I brought those 3 that I kind of focused in on.
Now, the 3 products you brought,
that's right.
What are they specifically for?
Now, these are for treating menopausal symptoms. That whole list of things that you and I were speaking about, the irritability, the night sweats, these are potential natural supplements that people can use to treat those.
Boost their hormones?
To correct, you know, if it's, sometimes we call it
hormonal imbalance.
Estrogen dominance, we call that.
Yeah.
So it helps our body deal with hormones better. Sometimes it kind of just takes the edge off of that estrogen dominant situation.
Okay.
So the first one there is chasteberry, and so
chaste tree.
That comes from chaste tree. Yeah. Now this is one that it's relatively new that I've seen, but the evidence towards it is really quite good, and I have seen it help some individuals as well. So.
Right.
Now, this one in particular, it can be quite strong, and the manufacturers and the articles do say that it can have quite an effect on hormones.
Yeah.
It
says on the bottle, actually, helps reduce symptoms of premenstrual syndrome.
Yeah.
PMS.
Absolutely, and it can. But people do have to make sure, because it is affecting hormone levels. There are people, where that is contraindicated. If they are, if they're on the worried about cancers and whatnot, please be careful before trying to take these types of products. Any kind of person who might be, where cancer is an issue, where the doctor says, I really don't want you to take any kind of estrogen supplements.
Right, so again, this is something you should really clear with your doctor first.
That's right, yep.
Right.
If it's not, just always talk to your pharmacist, talk to your doctor. That's a good thing, because they have even a better picture.
What do we got here?
Again, Remifem, these are other supplements.
This is a common one, eh? This is a more common sort of one?
Definitely more common. People have heard of black cohosh. That's been around for a long, long time. This is one product where they've actually done a lot of studies, and they've actually found some results, some European studies. Right. But in terms of products that actually have benefits and proven benefits, this is one of them.
Gotcha.
Again, do be cautious if you're going to talk to your doctor about these types of supplements too.
Yeah, okay. No matter what it is.
Right.
I want to get to this one too. This is Estrovera.
Estrovera, a new one that's come to the market probably in the last couple months.
Yeah.
It's Siberian Rhubarb. Another
Siberian Rhubarb.
It has estrogen effects, and but it's helped a lot of people. And again, if people that are willing to try these types of products, make sure you do discuss with your doctors, because it's a good idea to make sure that it's not contraindicated for you.
You know what? I get the feeling, Scott, from what I know, or what I've heard, or this is so individual.
Absolutely.
Right? It can be completely different from one person to the next.
Yep.
So the advice of a doctor and a pharmacist, and I would say both in this case, is pretty well vital to finding a way through it, correct?
Absolutely, Kurt. Absolutely. And in fact, one thing we're probably going to talk about next is the bioidentical hormones. And that is another way to really individualize a person's therapy. We
do have we want to go to the caller now? Do we have a caller on the line? What's this person's name?
Yes. Good morning, Kurt.
Hi, what's your name?
The pharmacy. My name's Sherry. How are you?
Oh, Sherry. Good.
Hi, Sherry.
Thanks for calling.
I'm 49 years old, and I've never heard of so many people, men and women, getting B12 today.
Mm-hmm.
Now,
as a
I know
measure
you're not a doctor, you're a pharmacy, but why is so many women and men on B12 today?
And we're talking about men and women with hormonal issues?
Yes.
Okay.
You know, B12, you know, talking to a lot of doctors, they are thinking that it can help with the absorption of certain nutrients. As we grow older, I do know that our stomach changes, and we just don't absorb as much from the foods, as much as those vitamins, minerals, nutrients from foods as we did when we were younger. B12 is very important. It's one of the B vitamins. It can help with energy. It can help with blood formation. It helps many indications for people. So energy is the main one. People that come in and they're tired and they're feeling drowsy all the time, one of the easiest things I think of is just
B12.
vitamin B12.
Yeah.
It's a very tough molecule to absorb.
Right.
And you'll often hear about people taking B12 shots where they go to their doctor and get an actual injection of
Right.
B12.
Right, but you can do it orally. And
You can do it orally,
Yeah.
and there's different forms of B12.
Yeah.
There's some that are more bioactive.
yeah. Isn't there a
but-
liquid you can get too?
Absolutely.
I think there is, yeah.
B12 liquid, yes.
That seems
But
to me to be the
and
best
it's
way.
it's a very simple thing to try, and because B12s are one of the water-soluble vitamins, so it's hard to get too much in your body. Your body will just
exactly. It'll
get rid of it.
expel the extra.
That's right.
We're going to take a break. One more chance for you to ask questions about hormones and the problems and issues they can cause and the solutions. Scott Watson's here from Watson's Pharmacy and Compounding Center. We'll talk about some compounds probably next. There's the phone number. Get in touch with us. And if you want to talk to Scott and his staff, 2 locations of Watson's Pharmacy and Compounding Center on Main Street and on Wellington. Go to the website. We'll be back after this. More of Ask the Expert.